My name is Dr. Shoaib Javed Khan. I'm a consultant orthopedic surgeon at NASA Hospitals, Kasturi Nagar, Bangalore. One of the most common questions asked to us is, can fractures heal without surgery? In a broad way, the answer would be yes, many fractures can heal without surgery, but let us discuss the exceptions also for your simple understanding. Let's go to the basics. The first thing we need to understand is when there is a break in the bone, the fracture healing requires 4 to 5 steps to form new bone again. The first step is what we call as hematoma formation, which is basically bleeding from the bone. The next would be inflammation. Next, formation of a soft callus. Callus basically translates to stone from Latin. So a soft stone. Next stage would be a hard callus, and finally bone formation. So ultimately the bleed from the bone helps in forming the new bone to help unite the fracture and heal it. So as a surgeon, it is very important for us not to disturb the hematoma unless really required. Now, there are various types of fractures, different types of fractures in the different fashions in which it breaks. Some are also illustrated here. We have transverse fractures, we have oblique fractures, we have spiral fractures, comminuted, oblique, avulsion, linear, various type of fractures. Let us discuss something very simple for us to understand whether fractures can heal without surgery and which type of fractures. The first basic thing would be any break in a bone. For example, a transverse fracture like this in the bone where there is no displacement. The cortexes, which are the outer walls of the bone, are in contact with each other. So even if a hematoma is formed here, bleeding, it will ultimately heal and it will join with time. Depending on the type of bone, this crack or break or fracture will disappear. So this kind of fracture does not require surgery. It requires very simple steps like immobilization in the form of a cast or a splint or a POP as we call it commonly. This fracture very ideally does not require surgery. Let us discuss another case wherein the same bone is broken but there is a displacement, okay, which means the cortexes, which I told you are the outside wall, are not properly aligned and not in contact. For example, something like this. Yes, something like this. Will this fracture heal without surgery? Now, you need to understand that as long as there is contact, it will heal, it will join. But will this bone, once it's joined in this manner, be able to take mechanical stress, mechanical weight, mechanical, the whole weight of the upper body or whichever part the bone is in? The answer is no. It cannot take the same amount of weight, which is why the patient will struggle if there is no intervention in this kind of case. So in some cases, we can externally, in the form of closed reduction, which means without any surgery, we can reduce the bone and bring it back to place. If that is possible and this bone after reduction looks like this, a simple POP, a splint, a cast should suffice. But in certain cases that is not possible. So in this, again, I would advise surgery. But if you ask me, will this unite? It will, but in this fashion, if it is not reduced. Certain bones have a mechanical stress on them, which means there are multiple muscles pulling them. So just reduction will not suffice. If I physically reduce this, there is a chance that this bone will get pulled back again because of the muscle. In such cases, we have to reduce it, and then from externally we have to place probably a plate and screws. Yes. Now a more complicated case. Let us discuss a more complicated case, which is probably a comminuted fracture. A comminuted fracture is one which has multiple pieces, multiple breaks in simple terms. For example, something like this, there is a piece here, there is a butterfly fragment here, multiple breaks So, do you think that this fracture is going to heal without surgery? It is unlikely. So, in such cases, what we do is we try our best to reduce everything, bring it in place. For example, the break would look something like this. Once we ultimately bring everything in place, we have to externally place some device to help hold this in place so that it does not move out of place again, does not dislocate again. So this kind of fractures for sure require surgery. So this hopefully helps you to understand and make it easier to understand how, when we do require surgery. We as surgeons try our best to avoid surgery unless it is really required. So please come visit us if you need our assistance, our services at NASA Hospitals, Kasturi Nagar, Bangalore. Thank you.